Rhinoplasty surgery is surgery to restructure or reshape or change the nose in some way. It's one of the most common procedures for a facial plastic surgeon like myself to perform. Patients have to understand that the nose is central to the face, and most patients come in with a good understanding of what they want, and it's my job to help them understand what's realistic and what can actually be done. Patients should understand how their nose should look at the end of all of the healing that happens, so they have a realistic understanding of what is going to change. Our rhinoplasty surgeries are commonly performed in the operating room with the patient asleep. And after they wake up, they'll usually have a cast on their nose. And I use an open approach to rhinoplasty, meaning they'll have a small little incision underneath the base of their nose right here with some stitches in it. After those stitches come out, that ends up healing very well and really essentially disappearing. A rhinoplasty is something that's going to take a long time to completely heal from. The nose stays swollen for a while, and it takes a full year for all of the swelling and all of the healing to take place. However, usually after a month to 2 months, patients have a really good understanding and an idea of what's the nose shaping up to look like. One of the interesting things about rhinoplasty as far as patient population is that it spreads the entire age range and is both genders. There's a lot of people that are looking to change the look of their nose for a variety of reasons. Some people are born with a nose that's misshapen. Often it's a family trait kind of nose. Some people have their nose broken and they'll want to come in and get it straightened out again after it had been broken for some reason. Some people may have had some other type of surgery performed on the nose and they're looking to change it back to what it was. Some people have functional problems with their nose, meaning they don't breathe well through their nose and they need some help functionally. And so we'll do that as well. And one of the important things about rhinoplasty is that in all that we do to change and improve the aesthetic of the nose, we never want to compromise the function of the nose. We have to keep in mind that number one, the nose is there to help us breathe better. And if it's not already optimized as far as how well a person breathes, we want to help optimize that in the same setting of making it look how we think it should look and how the patient would like it to look.